students, in this session we are continuing with the spirochetes. We have learned Treponema pallidum, so two more are left, Borrelia and Leptospira. So regarding Borrelia, it is similar to Treponema pallidum. This one is also spirally coiled because this is also a spirochete. But the thing is, it is having lesser coils and they are more wider than Treponema. It will be like this, wider, irregular, wide, open coils. It is like 3 to 10 coils. So it's a more broader one. So it can be visualized by light microscopy to some extent. Though it is poorly gram stained, it's not that thick as the other bacteria, but still you can visualize it by gram staining to some extent because it's a more broader one compared to Treponema pallidum and Leptospira. And this one is also motile like the other spirochetes. This is also motility is because of the endoflagella. All kind of spirochetes have got endoflagella. It's a gram-negative one, as any spirochete has got a gram-negative cell wall. And you can do this isolation of Borrelia from blood culture by using a special medium called modified Kelly's medium. So this is a special medium. You know, in Treponema and Treponema, you can't do culture in artificial medium. We can't cultivate treponums in artificial culture medium. But for Borrelia, we have a special kind of medium called a modified Kelly's medium. And what are you using as the sample? The sample is blood culture because this is basically a bloodstream infection. The organism gets into the blood and goes to different organs. So there are three important species, medical importance, three pathogenic Borrelia species, Borrelia recurrentis, Borrelia vincenti, and Borrelia burgdorferi. So recurrentis, I told you we can remember recurrentis by R4R. R causes relapsing fever. And vincenti, it is causing a condition called Vincent's angina. It is actually something which affects the oropharyngeal mucosa, causing stomatitis, gingivitis and all. And this doesn't cause infection by itself. It is always seen in association with an anaerobic bacteria called fusiform bacilli. And burgdorferi, Borrelia burgdorferi is the causative agent of a condition called Lyme disease. So we have to remember the causative agent of each of these conditions if this is asked for a short note. So Lyme disease is caused by Borrelia burgdorferi and the vector here is Ixodes tick. So you get the infection from a tick bite, Ixodes tick. At least remember this is tick bone. Lyme disease, the vector is tick bone. And the treatment for Lyme disease is doxycycline. And Lyme disease, the patient will present with fever, then arthritis, severe joint pain, arthralgia, and in later stages, they can have neurological manifestations also. So Lyme disease is caused by Borrelia burgdorferi, the vector is a tick, and treatment is doxycycline. Coming to recurrentis, causes relapsing fever. Relapsing fever can be of two types. It can be louse bone relapsing fever, you call it as louse bone, or it can be tick bone. Tick bone or louse bone relapsing fever. The more common organism causing relapsing fever is recurrentis. And coming to Vincenti, which causes Vincent's angina. What is meant by Vincent's angina? It is nothing but a gingivostomatitis or oropharyngitis. Gingivostomatitis. It causes inflammation of the gingiva, of the oral mucosa, or of the pharyngeal mucosa. So this always causes symbiotic infection along with the fusobacterium, which is an anaerobic bacteria. So that is Borrelia vincenti. And if you want to treat Borrelia vincenti, you give penicillin plus metronidazole because it's a symbiotic infection with an anaerobic organism. You require metronidazole also. So these are the three Borrelia species that cause the important diseases: Lyme disease, relapsing fever, and Vincent's angina. Coming to the next one, that is Leptospira. Leptospira, the genus Leptospira is classified into two species, Introgans and Biflexa. Biflexa is mostly non-pathogenic. So what is pathogenic is Leptospira introgans. So Leptospira introgans, you call also the subspecies as Leptospira introgans icterohemorrhagia. So that means it can cause icterus, that is jaundice, and also it can cause hemorrhagic manifestations. So this one is also a spirochete. It's a spiral bacteria, but you can see the coils are very closely set, not like Treponema or Borrelia. Here it's having a very close spirals with hooked ends at either ends will be hooked. It will be looking like umbrella hooks. That's hooked ends at both the end. So that is Leptospira. They are also actively motile. And what is the reason for the active motility? If a spirochete is actively motile, the reason is endoflagella. I'm repeatedly saying this for you to remember. Endoflagella, it is present only in spirochetes. This is also very thin and delicate. Not like Borrelia where you can go for a light microscopy, but for Treponema and Leptospira, you definitely require a dark ground or phase contrast microscope. Otherwise, you cannot visualize them. So, pathogenesis of Leptospira, this is a zoonotic disease. Here, the reservoirs are rodents. Rats are the reservoirs of Leptospira. So, this organism will be excreted in the rat urine. So, if a person gets exposed to rat urine, especially through an aberration or cut, this organism can enter into the patient's blood. So this is very commonly seen in agricultural workers who go to work with barefooted. Barefooted, what happens if they have some kind of cuts or abrasions in their foot, if they are getting exposed to rat urine, which might be contaminating the water which is present, the water which is contaminated with rat urine, if they're getting exposed to that, these spirochetes, these leptospires can enter through these minor cuts and abrasions, or they can also enter through the mucous membranes. If you get exposed to a splash of water contaminated with rat urine over your conjunctival mucosa or your oral mucosa, that can also lead to disease of leptospirosis. So it enters through cuts and abrasions when you get exposed to rat urine. So incubation period is like less than 1 week, and it usually present as a fever, febrile illness. Patient will be having constant fever, which lasts for 3 to 7 days, and it can again repeat. It can be a biphasic fever, a one episode of fever which comes down, then it again starts peaking. So like it can be biphasic, and first it is a febrile phase. After that, this organism will disseminate to different organs like liver. Through blood, it will disseminate to liver, kidney, brain, and lungs. And the most favorite organ is liver and also kidney, and to some extent brain and lungs. So basically the patient will present with fever and jaundice because liver is the most worstly affected organ. Also they can present with meningitis, they can present with dysuria, or, anuria or oliguria because of involvement of kidneys, and it can present with pulmonary manifestations if there is involvement of lungs. So when you see fever and jaundice in a patient, especially an agricultural worker or somebody who is exposed to contaminated water, fever and jaundice along with conjunctival suffusion, that is another condition that is commonly seen in leptospirosis, you have to suspect jaundice. So leptospirosis is the condition. You call the disease as leptospirosis. Another name for leptospirosis is Weil's disease. So please be familiar with this term also, because sometimes the question can be asked like this: Weil's disease. It is nothing but leptospirosis, where the organism disseminates to liver, kidney, lungs, and brain. So when there is liver involvement, you will see jaundice. Renal involvement will present with the other manifestations like oliguria, anuria, and failure, renal failure picture, elevated RFT, LFT, and all. And sometimes patient can have aseptic meningitis because of brain meninges involvement. And if there is pulmonary manifestations, pulmonary hemorrhagic manifestations can be there in case of leptospirosis. All these are together called as Weil's disease. So how we are going to diagnose leptospirosis? The specimen is blood, like in Borrelia. Here also the specimen is blood. You're going to look under dark ground microscope. You will see this motile, the corkscrew motility, and this hooked ends with closely set spiral coils in leptospira. Blood examination is useful in the first week. Afterwards, what happens? No, when the antibodies start appearing, the organism will disappear from the blood, but it may be present in urine for a longer duration. For 10 to 30 days of infection, the organism will be present in the patient's urine. And you can do culture in some special medium. Unlike treponems, which cannot be cultivated in any kind of artificial media, we have seen in Borrelia, you can use a special medium called modified Kelly's medium. Here we have two types of medium, EMJH medium and also Cortof's medium. So these two are the special media that we use for leptospira. EMJH, it is having a very good expansion, Ellinghaus and McCullough, Johnson, Harris medium. Even if you can't remember the expansion, the complete form, just remember the abbreviation EMJH medium. And another medium is Cortof's medium. But apart from culture and microscopy, what we can commonly do for leptospirosis are the serological tests. Like for treponema, serological tests are the standard test for diagnosis for syphilis. Leptospirosis also is diagnosed by the serological test. You take the patient's serum, you look for the antibodies. We have different tests like enzyme-linked immunosorbent assay, ELISA, and immunofluorescence test, indirect immunofluorescence test, which is used for screening of leptospirosis. If you want to find out the exact serotype which is causing the condition, you have to do agglutination test, where you have microscopic and macroscopic agglutination test available for detecting serotype specific to find out which serotype is causing the disease. Coming to treatment of leptospira, we are talking about Leptospira interrogans because that is the most common species causing leptospirosis. Penicillin is the drug of choice for leptospirosis, like for syphilis. Here also penicillin is the drug of choice. Alternative drug is doxycycline. If you want to give prevention, like how you can prevent the disease, you have to go look for the general sanitation. You have to look for the rodent eradication, rat. If there is plenty of rodent infestation, you have to go for eradication. So general measures have to be improved for prevention. Rodent control is important. If a person is exposed to this rodent in contaminated urine, contaminated water, especially during floods, those people who are involved in flood rescue operations and all, you give prophylactic antibiotic for them, and for prophylaxis also we give doxycycline. So doxycycline is a very good drug for prophylaxis of leptospirosis. If you say about treatment, the first drug is penicillin. An alternative drug in mild cases, you can give doxycycline. So we have completed Treponema pallidum causing syphilis, Borrelia causing Lyme disease, relapsing fever, and Vincent's angina. And we have seen leptospirosis caused by Leptospira interrogans. So syphilis is the most important question from this part. Anything can be asked about Treponema pallidum, but you can also get questions about Borrelia. Borrelia can be asked what are the diseases caused by Borrelia. And leptospirosis can also be a probable question, a short note that can be asked for exam. So please read the important headings which we have discussed, like what are the pathogenesis, what is the disease condition, how will you diagnose the condition, and the various species names of these particular organisms. So all these can be asked as questions. We wind up spirochetes with this. Thank you.